Hi, good morning. So Net Patient Foundation has been around since 2006. I co-founded it with my partner and another patient. Unfortunately, my partner died the year later, and so I decided to leave my nursing position from the Royal Free Hospital and try and focus on bringing a little bit more support into the community. So I've been there now for 12 years, and these are our 5 pillars of activity. And we do that very much alongside a medical advisory board, which is really important to us, including other nurses, dietitians. We have our psychotherapy support, and obviously our physicians too. So last year, 2018, we did a big audit of our services and realised that we were going to have to make a few changes. So a couple of the changes that we made was in our information resource. We have quite a big repository of information for our community, including a very large handbook, which isn't meant to be read all at once, but we've just redone that book now. We did a pilot study through 2016, 2017, and in 2018 we got the results of that. We had the book reviewed by 2,500 patients, made all the changes that we need to make, and now we're ready to put that out as a finished product. We developed a new patient pack, so for patients who are newly diagnosed, to ensure that every hospital had boxfuls of them, so that at least when you get diagnosed you have something. We also looked through some of our feedback from some resources, and something that was incredibly clear is that each individual net type really does want some dedicated resources for them. So this year we started our first lung net advisory board. And we had our first meeting where we went through all of the information. We'd done a big literature search, really trying to find out what patients with lung nets really want and the support services that they want. So that's an ongoing project for this year. We also had a look at our support services, and we needed to develop that. And we brought Kim and her colleague Steve on board in 2018. Was it 2017 now, I think? We have a nurse service, so we did have 3 nurses. Unfortunately, we're down to 2 at the moment, but ultimately what we're trying to do is ensure that there's 1 nurse in each of the devolved nations. But again, there's a big funding issue with that. We've developed a patient self-management tool, which we're hoping to launch this year. This has been a really important tool because it's going to be one of our research tools in the community, looking at self-management and quality of life. It's something that will be completely shareable with your clinical team, but we're just waiting now for the NHS to agree to put this as part of their research portfolio. And once we've got the NHS on board, then that's something that we can use and launch UK-wide. So we're quite excited about that. We're trying to also get some involvement with the FACNet team so that we don't have to put on the Net21 quality of life questionnaire because it's so desperately long. And it is very focused on GI nets. We are a community that tries to support all of the neuroendocrine tumours apart from the gen nets, which of course Jo does so brilliantly. We developed our first newsletter, and so I'm really impressed. I think Carsten, all you do 4 times a year. I think it's really hard work. But we've only done 1, and we will only be doing 1 a year for the time being. But we have just started work on our new medical net news. So this will be a completely medical healthcare professional publication, which we will use in our campaign of neuroendocrinologists of the future. So we do a campaign each year where patients go into all of the medical schools and really try and raise awareness of nets amongst the doctors that will hopefully be our clinicians later on. We obviously launched the Mind the Gap campaign, which I know you've heard about in this meeting. And we also launched our Faces of Nets campaign last year, which you can see this lady here, which has been really impactful actually, really just trying to ensure that we've got plenty of content on our website. We've also had a number of interesting projects advocacy-wise with trying to input into the NH Cancer Plan. And really try and ensure that rare and uncommon cancers are included in that. We've been working with NICE to try and change a pathway so that we're not dealing with the pathway for common cancers but rare and uncommon cancers. And we've also been trying to work with all of the local councils to try and encourage them to do awareness for rare and uncommon cancers, and we did the first one last year, which was a huge success. So that's kind of where we are this year.